Zachary Smith, June 9th. I'm going to talk about the surface anatomy video. I live alone and it's coronavirus, so I don't have a model, so I'm just going to do this on myself. So I'm going to talk about the surface anatomy of kind of the upper arm and elbow. So looking at myself, we have bicep, tricep in the back, brachioradialis on the side, and then we have the medial and lateral epicondyle. And those are the two structures that we're going to go into a little bit more detail. Just backtracking a little bit, the bicep, tricep, and brachioradialis all part of the muscular system, and then the medial and lateral epicondyle are part of the skeletal system. So important landmarks, medial and lateral epicondyle, and two areas where we commonly see potential injury in the orthopedic world. So if we remember from the muscular system, the lateral epicondyle serves as the origin of your extensor mass. So it's the group of muscles that attach on or around the lateral epicondyle and then extend the wrists, and then some of the muscles help extend the fingers as well. So overuse, repetitive extending of the wrist from different activities. One of the common reasons why it's called tennis elbow is your backhand swing in tennis. So repetitive extension of the wrist causes tendinitis from the repetitive pulling on the lateral epicondyle, and typically people will present with tenderness right over the lateral epicondyle. So if you can see that, find it, and palpate it, that's pretty much where the pain will be. And then similarly on the medial epicondyle, that's where are your flexor mass, so the muscles that flex the wrist, and then as we know, some of the muscles that originate at the medial epicondyle also flex the fingers. And then tendinitis in this area is called golfer's elbow. So repetitive flexing the wrist will cause injury to there. And again, people will typically present with pinpoint tenderness right over the medial epicondyle. Important to be able to know the surface anatomy because it helps, obviously know what structures are lying beneath the skin. So being able to use these landmarks, know what's underneath it, knows what attached there, and then we can accurately diagnose potential injury as well as know how to treat it. Typical treatment for most tendinitis, so rest, ice, compression, elevation, and then activity modification. So either taking a short break from the activity that was causing the overuse, or potential bracing, corticosteroids, oral steroids, all common treatments. Pretty rarely surgical treatment, but sometimes if all conservative treatments fail. So that concludes the surface anatomy video and why surface anatomy is important in the orthopedic world. Thank you.